all celebrating all sorts of ideas, which was really Cumbria. It's all they have snacks against all the time. We are going to talk on how long is too young to stop speaking now and how you can that's good. I think we can be on stage. We're going to it's the great. It's cool. I have all of my maps and everybody on, like in and then on stage.
Welcome everyone. We're delighted that you could join us this morning for our Family Hubs Huddle. And I'm just waving off there. Mike McKean, our clinical lead, sends his apologies. He was hoping to join us and lead the session today, but he's got a clinical matter to attend to.
Something urgent's come up. I've got to go and sort out a patient. I do apologise. I hope you have a fantastic time and I'll look forward to hearing lots about it and all the learning. So hope you enjoy.
Fabulous. Thanks, Mike. All the best. So we have got a bumper-filled session, so we must press on. We have a very formal format to these huddle sessions, and the purpose of those is to share good practice and really generate discussion regardless of the part of the system that you're from. So thank you to those of you that are already putting in the chat where you're from. We've got a real rich of people attending from local authorities, from education, from mental health and physical health. So family hubs are really key and of interest to everybody today. Today also marks the important publication of a report from Newcastle University, and I'm delighted that Amanda Bailey's going to say a few words, and we're going to put in the chat the publication that's really relevant to the discussions today. So rather than do our usual intro on the network, we will just go straight to the vision slide, which just reminds everyone these huddles are presented by the Child Health and Wellbeing Network. We sit within the ICS, and the vision that we work to is that we come together across organisational boundaries to enable young people to thrive. So that's the vision that we all work towards. And when asked, we were told, please can you share good practice, drive work forward and connect us into experts and groups. So today's and our Huddle programme is a key part of that. So we're delighted that so many of you have been able to attend us today. You will have noted that the session's been recorded, and also please do feel free to tweet. Our Twitter handle's at the bottom of that slide there, and it's #FamilyHubsNENC if you want to add that into your message. So now I will go straight to Amanda. If you want to come off mute, Amanda, and so she can share the poverty report that has been published this morning. These slides will be available afterwards for reference. Thanks, Amanda.
Thank you. And just to say, I'm from the North East Child Poverty Commission. We are hosted by Newcastle University, but we're independent of the university, but have been hosted by the university since 2019. And it was just a flag that we published a new report this morning, which looks at, we possibly all on this call know that the North East now has the highest rate of child poverty of anywhere in the country, and that's for all ages of children. So almost 2 in 5 children across the North East now living below the poverty line. That rises to 47% for families or children in families where there's an under 5, and that's obviously very pertinent to the discussion today. And again, that's the highest rate of anywhere in the country. And we published this report today to look at why it is that child poverty is now so high in the North East, what are the combination of factors that have driven that, and critically, why we've seen a really steep increase in child poverty in the North East since around 2014-15. So there's a clear longer term trend that's existed well before the current cost of living crisis, well before the pandemic. And so if you take a look at the report, and Heather will share the link, it goes through all those different factors, but it also, we spoke with a lot of different organisations around the region who are now providing support to families with young children, often to meet their basic needs. So there are a growing number of what are known as baby banks around the North East. So they're like food banks, but for baby related items. We spoke to food banks, to children's charities, to organisations providing frontline advice about the level of need that exists currently in the region. And we've made a number of recommendations, mainly for government, around the sort of immediate measures we think are needed between now and to get families through the autumn and winter months, but actually again emphasising that this is a long-term issue for the North East, and that tackling child poverty has to be really central to the wider levelling up agenda if that remains in place. And one of the recommendations for government is, and you'll see as the third bullet point there on the slide, around providing what we describe as transformative investment for family hubs, which would recognise the level of across the board need in the North East, the fact that family hubs are now intended to provide support to families with children aged 0 to 19, not just 0 to 5. But we want that support to be as universal as possible, so that it's not stigmatised, it's not support that only certain groups of families are able to access, because one of the key things we found in our research is the level of concern that many families feel around trying to access support and what that might result in for their families. So we think family hubs should be as universal as possible. And that's it from me. Thank you.
Fabulous. Thank you ever so much, Amanda. And I know whilst you were scheduled to attend the full event, I think you're being pulled out to do various media responses to the publication. So many thanks for the time that you can spare us this morning. And if anyone's got any specific queries, if they want to pop them in the chat, maybe you'll get a chance to go through a few of those.
Kelly up here.
So if we can move on to the next slide. The format for today is traditionally, and we're delighted to have a real wealth of experts in our region, and we're delighted that Catherine Bolton could join us today to chair the event and introduce the various speakers and the key panel members that we have today. Catherine will chair the session and we'll take questions from the chat. Occasionally people will be invited to come and perhaps verbalise their question if they're invited to do so. So if I can encourage you all to pop your questions in the chat throughout the sessions, and also the speakers will, when they're not speaking, be able to respond to those as well. So Catherine Bolton, we're really pleased. She's the Corporate Director for Children and Family Services in Redcar and Cleveland, which you will all know is down in the south of our patch. And she's also an elected director for the National Board of Association of Directors of Children's Services. So obviously her leadership and expertise is key to facilitating this session. She's worked in education and children's services for over 35 years and is passionate about making a difference to children and families, and in particular the importance of early intervention and best start in life, which again is very, very relevant to that publication this morning. She's a good friend to our network. She is our regional educational group, and more recently the Director of Children's Services representative on our executive board. And we're so delighted that she's agreed to chair this huddle on family hubs. So thank you very much, Catherine. Over to you.
Thank you very much, Heather. Thank you very much for that introduction and for the opportunity to chair this really important huddle. It's my absolute privilege. And just want to say a warm welcome to everyone today, and thank you for finding the time to join us. It's an exciting time for family hubs, and I know there's absolutely loads of development going on across our region and a lot of work taking place. And Heather's already really outlined the purpose of today's huddle, but just to confirm, this is just an opportunity to open up the family hub conversation to a broader audience across our ICS region. And I notice from all of the introductions in the chat that we have got an absolute wide range of colleagues and partners here today. The purpose of it is to share practice, but also to share and extend our learning. And I know for me, there will definitely be some learning here. I know that already. So we'll have a good chunk of time later to ask questions. So please think your questions through, no questions out of bounds, and we will come to those later. Before we get to our Q&A session, we are really fortunate to have some excellent colleagues with us here today who are going to present what I'm sure will be some really thought-provoking and informative input. So I'm just going to introduce our colleagues, hand over to them, and then we will come to the Q&A after that. So firstly, we have Catherine Barker. Catherine is the Head of Development at the Family Hubs Network. That's an infrastructure organisation. They've got an absolute wealth of good practice from across authorities, and has very successfully campaigned for Family Hubs to become policy. So well done for that, because here we are. Family Hubs are now with us. So that's absolutely fantastic. So Catherine will be our first speaker. And then we will hear from Bronya Arnott. Now, Bronya is our regional coordinator from the National Centre for Family Hubs at the Anna Freud Centre. And Bronya leads on the development and the implementation of family hubs across our North East region and also the North West region, and is supporting the development based on what works and the evidence that we have. So I think you'll agree with those two colleagues, a wealth of information. We've also got a couple of colleagues that are going to input and share their experience, but Bronya will introduce them when we get to it. So I think we're delighted, Catherine and Bronya, that you're able to join us, and thank you very much for that. And without further ado, I will hand over to Catherine at this point.
Thank you, Catherine. I'm really delighted to be here today. It's great to actually be speaking to such a broad audience, because one of the issues closest to my heart is ensuring that the implementation of Family Hubs policy really does reach the broadest reaches of those working with children. So the more people who understand what's happening here, the better Family Hubs can reach their potential. I work for the Family Hubs Network. We're an infrastructure organisation helping all stakeholders as Family Hub policy is implemented across England. And we are really, really keen to ensure that people get a real sense of the potential of what Family Hubs can be. So my presentation today is a whistle-stop tour through Family Hub policy based on what we've learned through our network. So let's start with a reminder of the need. Can I have the next slide, please? Oh, there's going to be a little delay, isn't there? So I need to speak ahead on that. This is a slide which is literally just going to remind us all of family-based problems. You'll see on the left the family-based problems. You'll see on the right the impact on children. If family-based problems are not resolved, we all know that children face poorer life chances. And that's the need that this work is addressing. Next slide, please. So where did the policy come from? Well, the context is that Family Hub policy brings together learning from over the last 3 decades, and it comes from a grass movement of local authorities and other stakeholders developing their work, often in times of austerity, often in times to save money, interestingly, in order to get better outcomes and focus on outcomes, not outputs, but outcomes, to really help tackle the issues that families are facing in their communities. It's building on the legacy of Sure Start Children's Centres and all the best of what Sure Start achieved. But unlike Sure Start, it is a very less prescriptive approach. That's because every local Family Hub network needs to be designed to meet the needs of the local community. It needs to also build on the existing infrastructure, especially making the most of places where families are already happy to engage and feel comfortable. And it's about achieving local as well as national objectives. When I meet local authorities who are feeling a bit unenthusiastic about Family Hubs, I say, what are the problems you want to solve? This policy should enable you to tackle those problems directly. So in order to achieve this new approach, we need stakeholders to work together to achieve those better outcomes. So let's move on to the next slide to just cover briefly how this is affecting at central government level. You'll see here a range of departments coming together regularly to discuss Family Hubs policy because they are all involved. And it is essential that we see that leadership from central government, because what we're looking for is much greater integrated partnership working on the ground. So to ensure that we achieve those better outcomes, we need to see that that cross-sector, that cross-department working at every level. So let's go on to the next slide to look at what a local hub network of working together looks like on the ground. I've given an example here of the connections that you might see between people and places. Every local authority designs its own local family hub network of people, places, services and support. So each network has places that function as family hubs where families can access the system and get help. These family hubs are often former children's centres. They can also be healthcare settings, libraries, leisure centres and voluntary sector hosted places. But the point is, a family hub is not an island. It's not a silo. It's not the answer to everything. It is connected to places and organisations that all play their part helping families in different ways. That means connecting into the work with schools and academies, with youth centres, with faith organisations who often have their roots deeply embedded in society. We have in the community, and we have a wide range of voluntary sector organisations in the community. It connects up with GP surgeries, it connects up with social prescribers, it connects up with the local hospital where the paediatricians have waiting lists which could have been reduced by families having better help when they were in the community. One of the reasons I'm here today is because Mike McKean said I can see the potential of this to help my family sooner so they don't need an appointment with me. Online access is also important because access and resources these days are a vital part in helping families understand, firstly, what's available and access that help, whether that's in-person support or online resources, which we all know from COVID has stepped forward in leaps and bounds. And that's part of the universal aspect of family hubs. And because practitioners and volunteers are working together, they can also help families who can be reluctant to engage. We've got, it's a network which is really reaching out into the community to help engage and bring the right people into the support that they need. So through this local network, a wide range of services is available, not just through the hub, which are these services put together depending on local need, local priorities, as well as you will find from some of the funding offered by central government, some specific services in particular, which Bronnie is going to be talking about the early years. But let's move on to the next slide, please, where we take a brief look at the services available. Now, it's a long list and you get a quick glimpse, and I think you'll be sent the slides afterwards, which is good. I'm not going to dwell on this. Suffice to say, when a local family hub network is effective, families can more easily get the right help at the right time. So if every network is made up of different places offering different resources, you may be wondering, what's the definition of a family hub approach to supporting families? Please just make it clear. So let's move on to the next slide, and I shall hopefully do that for you. At the Family Hubs Network, we have, as I said, collected examples of good practice and campaigned for family hub policy. In our work, we identified 9 principles that go to make family hub policy, and we are pleased to see that they are reflected in the Department for Education's programme guide. The key point that Department for Education has made is these key themes of access, connection and relationship. And those 3 words are key. I'm not going to go on about them now, but it'll come through my presentation that you'll see that it is all about these 3 themes, if you like. So let's take each principle in turn. Next slide, please. The first one I'm going to talk about is access. If we want families to get help, it needs to be easy to access, either for them to get help through themselves or be referred by somebody else, but also it's about them feeling comfortable to engage. So family hubs are very much so non-stigmatizing places. Every family has a reason to visit one, whether it's for their maternity appointments, registering baby's birth, getting postnatal support, all are welcome. And for this to work, we need high awareness through branding, signage, word of mouth and reputation. The community needs to know, practitioners need to know, everybody needs to know you can go to the Family Hub. They're nice people there and they are ready to help. Co-production, therefore, is going to be a very important aspect to get community buy-in. Access means long opening hours, including evenings and weekends. Lots of local authorities beginning on their Family Hub journey won't be doing this just yet, but those with more mature models are definitely aiming to do that or delivering that now. Without effective access, we cannot aim to achieve our objectives of early help and prevention, which is what I want to talk about next. Next slide, please. See, early help and prevention lie at the very heart of the Family Hub model. Getting the right help at the right time really matters because problems are easier to solve if they are tackled sooner. Many local authorities already have excellent early help strategies, but Family Hub policy is about prioritising that work and putting it at the heart. We want prevention. We want fewer families to suffer. So self-referral is essential so that all families feel empowered to walk in and say that things are going wrong. It's about making families welcome straight away. And it's about there being no wrong door. So when I'm talking about awareness, other practitioners in other areas need to know about the Family Hub and be able to know how to access it. So if we move on to the next slide, please, we're creating accessible early help, and that starts with the early years. So the early years is a good place to start. From that very first maternity appointment, those early years are crucial, and we need to identify those families who need that additional support. Co-locating health and early years services in the Family Hub ensures that families at that busy stage of life can access that one-stop shop and get all the help they need. Trusted relationships are created during those early years, and the Family Hub becomes a place which is really, really valued. Therefore, it makes sense to keep the door open and not say once your child reaches school age that all help has to be through the GP or through the school. It makes sense to keep the door open so that families can always re-engage. So moving on to the next slide, let's talk about those 0 to 19s. It makes sense for families. Families come in all shapes and sizes. They don't think about cut-off points. And families, their problems are often interrelated. So it makes sense to look at it all together. There's a lot of concern, though, about how do you make family hubs which are flexible for all age groups? We're used to children's centres, we're used to early years provision. How do you do it? Well, I can reassure you that I've been travelling the country seeing lots of places where they have been able to do that transformation. And I know Kelly Wigley from Stockton will be talking about her hubs later, which are a great example of that flexible space where you can have rooms which can host early years stay and play, through to becoming a parenting programme classroom, through to becoming a youth hangout in after school. The key issue, though, for this to be a 0 to 19 service is not that the hub provides everything in the building. There is a degree of co-location, but it's about the local network of people, places and services that are accessed through that hub and through those relationships. A family hub approach is about one system for all families. So let's move on to the next slide where we talk about how that really helps facilitate the whole family approach, which is an essential part of family hub policy. This involves a change of culture for some. We know that whole family approach is practiced brilliantly by some practitioners, but for others it's going to be new. Every organisation, whether public sector or other, needs to think whole family approach. Why is this so important? Because to understand a family's needs, understanding the family household context and the challenges faced by other members of the family, as well as that child with perhaps the presenting need, that's the only way to ensure that the core problems are identified and tackled. You'll have heard the example of the 9-year-old girl who experienced, I think it was 19 interventions, none of which made a difference until it was realised that the mother was suffering very severely with her mental health. It hadn't been tackled. Once that was tackled, the daughter's problems soon disappeared. Sounds simplistic, but it's a true story. Sometimes, however, getting to the most important problem for families, as in the case for that family I just mentioned, is not easy. It doesn't always come out in that first conversation, which is why the next principle on the next slide, please, is important. That's a relational culture. Everybody who works in a family hub network needs to be aware of how to establish a relational culture. It's not just about being family friendly. It's not just about making people from all backgrounds feeling welcome and accepted. That is a given. It is about the skills to put a parent or carer at their ease, to build trust quickly, to perceive when someone just needs signposting or when more searching questions are required, to really begin to understand their underlying needs. We see this exemplified. Thank you very much. in the front desk, those people who've got the right skill set. It's also about colleagues working together in a relational way. So as well as relationships within the hub and relationships within the home are equally important in a family hub approach. Let's move on to the next slide. Relationship support is bringing the DWP's reducing parental conflict work to the heart. I haven't got time to talk about it much here, but it's so important to understanding that unresolved conflict impacts children's lifelong outcomes. And therefore we need parents, whether together or apart, to help resolve their conflict. And we as practitioners need to be able to help parents do this better. And this is at the core of Family Hub work. So let's move on to the next slide, because I think one of the things I keep talking about is people working together, which is integrated working. This covers multidiscipline, multi-agency, coming together to talk about who's going to do what to achieve the right shared outcomes for a family, but it's also at a governance level, bringing together sectors to talk about how the local Family Hub network is working together to achieve those objectives. It's about seamless transitions, sharing data and shared outcomes. So let's move on to the next slide. Just to underpin that when I say cross-sector, I really mean seriously about the local voluntary sector and community. Too often we are restricted to the conversation about who is a supplier and who is not, who is receiving funding. Sorry, am I being interrupted? No, I'll just finish off. So the voluntary sector know their communities, they're often trusted, they can offer long-term relationships. I can't go into lots of detail here, but having them fully involved in the work of the hub, Isle of Wight is a very good example of where they do this very, very well. I was visiting there the other day, is a great example of really bringing in the voluntary sector and ensuring this is a sustainable, universal approach. My last slide draws out a few things I'd like you to consider. This cross-sector nature, next slide, please. This cross-sector nature of public, private, voluntary and community sector is key. The considerations on the left are things that we need to think about and we need to get right for family hubs to really, really work. That knowledge, that partnership, governance, trust, communication, data sharing, shared outcomes. And on the right, bearing in mind that other things that are going on are not separate from this. The integrated care systems are part of this. The social care review findings and recommendations are part of this, and so on. And I just want to thank you for your time and say on the last slide, you'll see my contact details. Please don't hesitate to contact me if you'd like a little chat or a long chat about any of this, because I'm really keen to be able to share any examples of good practice we've collected from around the country. Thank you.
Thank you very much, Catherine. That was an absolutely brilliant overview of family hubs and very succinctly put. I know we've got a very sort of tight timescale, and just to let everyone know, we have agreed that we'll do a 2-minute warning. So thank you very much, because that was just a really, really great overview. So now we've had that overview, we are going to pass to Bronya, who is going to talk to us about the development and implementation of family hubs, and introduce Kelly and Jackie, who are going to also present. So thank you very much, Bronya. I'll pass over to you.
Thanks, Catherine, for the introduction. Thank you, Catherine, for providing the introduction, background to Family Hub's agenda and setting the scene for where we are now. And I think we're at a very exciting time for family hubs across the country, and particularly in this region. And that's why I'm really grateful for the network for hosting this event today, so that we can involve more people in the conversation, so that we can get things right for families. And I think this was only highlighted by Amanda, who spoke earlier about the North East Child Poverty Commission report that's been published. So I'm Regional Coordinator for the North East and North West at the National Centre for Family Hubs. And the National Centre for Family Hubs is funded by the Department for Education to facilitate the development and implementation of family hubs. And it's hosted by the Anna Freud Centre. So if we could move on to the next slide, please. This tells you about how we work at the National Centre for Family Hubs. We work in a way that is evidence-based, practice-led and participation informed. Next slide, please. If you move on a couple of slides, I'll just, thank you. Yeah, so we're evidence-based, practice-led and participation informed. If you move on to the next slide. Oh. Yeah. Yeah, just checking, sorry. So I'm going to tell you a bit about the evidence base. We have learned what the evidence tells us about what works and is good value for money in relation to family hubs. As part of the National Centre for Family Hubs, we have a resource library that is regularly updated by a team of experts and includes reports such as this one. It was a review of early childhood services from our evidence partner, the Early Intervention Foundation, and it found that universal services within hubs were able to remove barriers to all families accessing services. Particularly, it provided an opportunity for the most vulnerable children and families to receive support, because we know that diverse communities and minoritized groups are much more likely to experience poor outcomes. They also found that by providing family support early in life through hubs, we could make an important difference to the first 1001 days, but also stop those problems before they escalated. They found there was a strong consensus around greater integration, which Catherine's talked about, because we don't want people and families to be falling between services due to ineffective referral pathways. We know that positive impacts of integration can be particularly seen, for example, with children and young people with special educational needs and disabilities. The report recognised that whole family approach, again, that Catherine touched on, is needed because parents and children are interconnected, and so are the issues that they face. And it concluded that trusted relationships are at the heart of family hubs, making families feel confident in attending local hubs and sustaining engagement with targeted support programmes. So if you move on to the next slide, we can think about not only national evidence, but also the role of regional evidence. At the National Centre for Family Hubs, we have developed with our evidence partner, the Early Intervention Foundation, the Family Hub development process, which takes into account local evidence. What does your population need? What do families in your area need? This systematic process takes you through the development and implementation of your family hub, ensuring that it is based on local needs and also that you can evaluate what you have done. So the process covers building consensus on the need for change, specifying your family hub approach to respond to your local needs, and planning implementation. And you can find out more about this process as part of our toolkit on our website. So if we move on to the next slide, what we also want to consider is not just the evidence, but what families tell us they want and need. Understanding what families want and need is critical to the success of family hubs. Next slide, please, Jen. So as I said, participation is critical to understanding what families want and need. And as part of the family hubs, local areas will be developing parent and carer panels, and this will put families at the heart of design and delivery. We have an implementation toolkit which can facilitate involving families in co-production and for your family hubs to be participation informed, including a rights-based approach. Next slide, please. The next slide tells you about the importance of considering a range of voices when we talk about participation to ensure that we are not excluding certain groups. Our conference earlier this month focused on co-producing accessible and inclusive family hubs. And one of our participation team, Nazreen, who is a young person with lived experience of accessing support, presented at one of those sessions on being ambitious for including families in the conversation, but also being practical. We need to include those family voices in service planning and delivery. So if you would like to hear more from the members of our participation team and about being ambitious but practical, please visit our website and you can listen to the recordings of those presentations there. If you could move on to the next slide, please. We also are interested in what providers tell us about effective delivery. At the National Centre for Family Hubs, we work at both a national and a regional level, and we understand the importance of local context for the development and implementation of family hubs. It needs to be right for the families in your area. We know that we can learn from other areas who may have similar populations, for example, in terms of ethnicity. We may have similar challenges, for example, in terms of rurality. So we include case studies as part of everything that we do, our toolkit, our conference, and our webinar series. We have a series of webinars that we have conducted, and you can go back and watch all of those on our website. One of the ones that we have coming up that may be of interest is the focusing on the findings coming out of the Family Hubs Evaluation Innovation Fund. This was commissioned by the Department for Education in collaboration with Sheffield Hallam University and Acoris UK. And the webinar will be providing insights from 6 local areas who have different models of family hubs and are at different stages of maturity, so should be of interest to everyone. If we could move on to the next slide, I'll tell you a bit about the fact that we have been learning and sharing best practice through regional forums, including one here in the Northeast. It's been a really dynamic community, and I've been really pleased to be part of it. And I'm thrilled to be joined by 2 of the community members today. They are Kelly Wigley and Jackie McCormick. They are representing Stockton-on-Tees and Northumberland. We're going to start with Kelly. Kelly is Service Lead for Family Support within Stockton Borough Council, and she is going to be telling us about the journey that they have taken to become a family hub in Stockton. And Jackie, Senior Manager in Early Help and Prevention Services in Northumberland County Council, is going to be presenting on the role of virtual and digital offers to address the key challenges of rurality. So first of all, I'd like to welcome Kelly, and then Kelly's going to hand over to Jackie. Thank you.
Lovely. Thank you very much, Bronya. So introduction's done. So I've been asked to talk you through the journey for Stockton with a little bit of background to transitioning from children's centres to family hubs and our challenges along the way. And I always say this when I do presentations, but I'm really not professing that this is the finished family hub model, but it's certainly making strides in moving towards a more holistic support model for families with children of all ages. But we continue to evolve along the way. So first slide, please. First, yeah, that's it. So just to give some context, just to provide a little bit of an overview of the demographics within Stockton. So we have a population of almost 200,000 residents, with 22% of those residents that are aged 18 or under. And I believe that we were ranked 73rd most deprived borough in England, and that was identified by the Index of Multiple Deprivation back in 2019, I believe. So just a little bit with regards to our backstory in terms of transitioning from a children's centre model to a family hub model, which was back in 2018. So this was approved by Cabinet in 2016-17 with a clear steer highlighting the need for resource to focus on prevention, identifying and dealing with issues at that first point. So at that point we had 12 children's centres which very much focused on the Sure Start vision, so supporting those children and families with children aged 0 to 5 with a focus on giving them the best start in life through that provision and services that were offered from those bases. So we've done things like baby massage, baby yogas, stay and play, weaning groups, breastfeeding, health drop-ins, etc. But we in Stockton then reduced this to 4 family hubs with the intention of very much a spoke model that would connect to communities and deliver support where it was needed. So the family hub model, I suppose, really seeks to build upon those solid foundations that are set from a Sure Start days. We do not want to move holistically away from that 0 to 5 model as we continue to recognise, as Catherine highlighted in her presentation, the real importance in the investment in early years. We're essentially building on the model to scope that out for ages 0 to 19 with a much broader remit of supporting families with children of all age ranges, and that would be universal access. So as you know, there's been no real framework or blueprint of what a good family hub should look like, or there certainly wasn't at my point, and it's very much left to the interpretation of each local authority, or was at the point I'd started taking responsibility for them. But overall, we want to create a space for hubs to be that one-stop shop, as again Catherine highlighted, for families having that support in one place. The system, as we all know, it can be really difficult for professionals to navigate the way through. So that must be really tough for families in terms of keeping up to date with what services are available and what support would best meet the needs of families. So therefore, regardless of needs, families can come to talk to us about issues or problems they're facing and be provided with the right level of support, and they don't have to go off to speak with multiple professionals to get the advice that they need. We want support services to be offered from those bases that absolutely hit the core of community needs, so those which address multiple issues that our families face. And if we don't offer it, then our staff within family hubs have that broad knowledge available to signpost and get other agencies involved and supporting those families. So next slide, please. So we have a range of groups running from family hubs, and I'm not going to go into any detail with these. If you do want any more information, then please contact me directly. But we have antenatal nurturing, so those from 26 weeks gestation and preparing them for birth. That may be families who've had children relinquished from the care previously, or it may be a young and anxious mum who needs that additional support. We have Solihull, it's actually 0 to 9 months, not 0 to 6. So when that reality of parenthood actually hits, this is jointly delivered by our health colleagues and family hub staff, which is brilliant. And babies come into the groups and attend the groups, so we can model some of those behaviours with our parents. Henry, 0 to 5, so looking at healthy lifestyle, family time. And again, this is jointly delivered by our health colleagues and family hubs. We have a nurturing programme, which is for parents with children aged 3+, and that's really a parenting support around setting boundaries, strategies, rewards, and the impact of parents' childhood on their own parenting in the present day. Talking teens for 10+, we generally say, so that's for, I always say this, but for parenting the Kevin and Perrys of the world, giving parents those strategies to manage that. We have EPEC, which is empowering parents, empowering communities, and that's for children aged 2+. And that is essentially a group that's led by our parents, who we train to deliver those groups. And we've just started there in Stockton. It's gone quite well, and haven't included it on there, but we've also got parenting crafts, so that is preparation for parents for birth of baby, and that's co-delivered by midwifery and family hub staff as well. Next slide, please. So I'm going to whiz through the next list that's about to come up to give you a little bit of a flavour of what can be accessed via a family hub within Stockton. So whichever of the 4 family hubs that you go to, each of these provisions will be offered. It's not a postcode lottery. We do have, and I haven't included it on there, on-site nursery bases for each of the family hubs. We have a library in just one of the bases, and we also have a charitable organisation, Family Action. We have a strategic partnership with them, and they deliver quite a number of our stay and play type groups. So we've got breastfeeding groups, healthy child clinics, those are delivered by our commissioned health service, Harrogate District. Stay and play groups that are delivered by our voluntary organisation. Yoga, massage, still recognition for the under 5 groups there and the need to have them. We have those running on a weekend as well, and late evenings. We have a range of learning and skills courses inclusive of maths, English, cooking on a budget. We have ESOL language courses where English is not the first language. We have drug and alcohol services, CGL, based there. They have drop-in services for both youngsters and adults. We have Harbour, which is our domestic abuse service in Stockton, and they have drop-in sessions there as well. It was really important for me when I first started to get those services in our bases, because there's so much stigma attached to going to the main buildings in the centre of Stockton. So that's working well to date. We have benefits advice, so we have two Department of Work and Pensions advisors who come and support parents around benefits advice, and also supports with job search as well. We have job clubs for 16 to 29-year-olds. We have CAMS workshops. They deliver incredible years, but we now co-deliver with them. Family Hub staff co-deliver with them. We have joint groups for youth. Our youth services for all school-age children, again co-delivered with Family Hub staff. We have relaxation programs for parents, which is a 6-week course to teach them strategies to manage their stress, anxiety and emotions. We have send drop-in advice and services. We also have Daisy Chain, who are our commission service in Stockton that deliver targeted intervention to children. They have groups for children with additional needs that run from Family Hubs, and advice for parents as well. Children who have a diagnosis or are on the pathway for assessment. And we also have our Stockton Parent Carer Forum drop-in services there as well, which are really, really well attended. And we have the Send Information Advice service that also attends. We have sleep workshops, toileting training. We have Relax Kids, which is mindfulness programs for children to manage their anxieties and worries. That's for 3 to 19-year-olds. We have active hubs for children of all ages and adults, which is exercise groups running on evenings and weekends. And we have co-delivered perinatal groups with specialist perinatal services that are co-delivered with Family Hub staff as well. So trying to link those parents in with our groups after that perinatal support does end. We have home safety, first aid, and I forgot to add that on there as well, smoking cessation. So quite a raft of support. I think you'll agree that's on offer from Family Hubs in Stockton. Next slide, please. So we have a framework, so what the data tells us. Next slide, please. We have a framework for data collection, which allows us to really review our strengths and our gaps in service provision. So the most recent, previous slide, please. The most recent report produced was from April to June. And as you can see, we had 92 parents self-referring, and as Catherine again highlighted earlier, we want parents to self-refer and not relying on services to do for them. So next time they do hit that bump in the road, they'll come to us for that support. We have 352 parents attend an evidence-based core parenting programme with us, 69% retention rate, so those who stayed on a programme from start to end. Some of our programmes are 12 weeks long, so pretty good going, I think, on the retention rate, and a total of 72% felt there was an improvement after intervention. Next slide, please. I'm conscious I've only got 4 minutes left, so I feel it's really important to highlight the challenges and the delivery principles that have arisen throughout. So it's not all been rosy in the garden to get to where we are now. And here are a few that we've experienced. So the data to evidence performance, we had to really build a whole system to enable us to gather that. So we built a whole system, and then in the midst of that, we've changed systems as well. But that really enables us to really identify our gaps, where we're working well, which services we need to target for those new referrals coming through, etc. Data sharing is much better. We have an integrated allocation process now in place with multi-agencies and other services across help and support. We now record on our social care systems, which has allowed a much more joined up approach. Very much, I think there's a real recognition from social care colleagues now, because we're recording on their system, so we're getting an increased referral rate from our social care colleagues. Co-location and co-delivery, we have health visitors based with us, and we have midwifery based with us as well. And it was educating services about not working in silos and coming together together to deliver. We all work with the same families, and there's more than enough work for us all to go around. So pulling that together, really. Mapping of parenting programmes. So we have a lot of providers externally to the local authority that deliver parenting programmes. So we're starting to map out who delivers what, so we're not duplicating or replicating any provision, and looking where we can jointly deliver. And we've already done some of that work with CAMS and health and midwifery. And finally, spoke models. So we want to expand provision further, and this is very much starting to happen. So we're starting to deliver in some of our schools parenting programmes. Some of our Relaxed Kids programmes are also delivered in school as well. Next slide, please. So benefits so far. So we're seeing a real integration of services. Next slide, please. Seen a real integration of services, and it allows for a seamless link with services, a much more joined up approach. More agencies and services are now aware of where to go to get the help and support for families that they work with, and in turn hopefully preventing more costly statutory interventions. Communities emerging. When Sure Start first launched, there was a real focus on targeting the most deprived wards. Groups are now mixed with those referred by social care, self-referrals, working class parents are all starting to come together. We're enabling families, so making them better equipped, as I said earlier, to deal with those future bumps in the road. So if they do hit that bump in the road again, they're coming back through our doors. Families feel safe to access the support. So again, goes back to Catherine's point of that, relationship-based practice. We need to feel like a comfy pair of slippers when parents walk into that door, and they know they feel safe and supported in that environment. And I think that just concludes that very much it is a strengths-based practice and not a deficit model. And final slide, please, to finish off. I'll leave that on the screen. It's slowing the slides coming up, isn't it? But these are just some, I must update these, but these are some of the comments that have been made by parents, and you can't see them yet. Is the next slide coming up, please?
It's coming in, showing on mine. Just give it time to come through.
It's a delayed link, isn't it? I think there.
It is, yeah, sorry.
No, it's not coming. The next slide is some comments from our parents themselves. There we go. And I won't read them out, but I think my favourite one was always, you should be on prescription. And I think that sums it up and says it all, really. So that's it from myself. And now I'm going to hand over to Jackie.
Hello everybody, I'm Jackie McCormick, and I sit within the local authority within children's social care as the senior manager for early help and prevention, but I also do want to make it clear that I work very closely in a design group with public health, with midwifery, with Harrogate District Foundation Trust in terms of health visiting, so it really is a partnership model from the beginning. Next slide please. So just to, while it's whirring, just to give you an idea about Northumberland, I did notice, I'm sure there's somebody from America on with us today. So just to let you know that actually Northumberland is a vast county. It's very mixture of rural, very deeply rural and urban. Two of our localities, our rural localities, just to give you an idea, it takes me 160 miles to get round 3 of them. So that's a real proper full day out. And then 2 localities are very urban, based on ex-mining and fishing communities, and they're the ones sort of down the coast. We also border with Scotland, so that's very interesting, especially for colleagues in Berwick Children's Centre, where a lot of the staff actually come over from Scotland to work. But we also border with Cumbria and North Tyneside, Newcastle, Gateshead. So yes, quite a big, vast area in the middle of everything. So next slide, please. No, sorry, not next slide yet. It's jumped ahead. Okay, so I'm going to talk to you a little bit about our Family Hub development and then focus on how COVID actually helped us to achieve and grow a virtual offer to those very rural communities. So there was a question that came through before the conference started, and then this was a question about how will collaborative working happen in rural communities. Northumberland has a really long history of innovative solutions to rural delivery. Since those, those people will remember, colleagues on here, those pram pushing days. Of course, pram pushing for us was just not an option in a lot of our rural communities. So you can see there we have our children's centres who will become family hubs based in rural fire stations. Our early help family worker team is based in Wutler Fire Station alongside firefighters. Excuse me. We did, in a small, very rural fire station, had a breastfeeding peer support group. We quickly found out that actually having the blue light, the blue shout light in the same room as where the breastfeeding was taking place was not a good plan, and we had to move it. We did get a shout and all the babies stopped breastfeeding. So we've learned quite a lot from that. And we also have a mini mess, which is based in Albemarle. Albemarle is a military barracks, very isolated, very rural. So yes, we did start in the days of Sure Start. We started with 26 Sure Start buildings and outreach posts. And whilst children's centres in Northumberland, they continue to operate against that sort of budget pressure that we did have in those sort of latter years of Sure Start, and we reduced to sort of 11 purpose-built children's centres, but that was okay. That was okay, because what we learned within that, and this is the learning going forward with family hubs, we learned to be more targeted. We learned from what works. We learned where we needed to base more. And this helped us to streamline and become more sophisticated in our delivery. So although we say, yes, we closed some buildings or some smaller buildings, that was okay, because it led to the partnership working and a real focus of what works where. So next slide, please. So again, this is just a reminder of the 3 principles of family hubs. I think for us, yes, the focus purely on early years in the Sure Start Children Centre model doesn't reflect the realities of family life. Significant needs still emerge during the child's primary and secondary school years, regardless of how well they've experienced early childhood. So this move in family hubs, this real move towards the whole family approach, is based on getting families in early. Yes, it is. But this should be the place to go when you hit the bumps in the road. When something happens, it should be that friendly space where they go, oh, I remembered that from the early days of my child. There was a reminder around, about boundaries and about sleep. And obviously, as the adolescent brain develops, again, it's boundaries, it's sleep. It's just reminding parents the same, but with slight tweaks for the age of that child. So that's what we're trying to promote, that when you hit a bump in the road, we're the place to come. Next slide, please. Just while that's whirring, again, colleagues from Sure Start days will know that we had different policy guidance on our work. We've had a different focus since 1998, and I happen to be one of the ones that have been here since 1998. So you can see we've moved through children's social care, then we were put in education, then we kind of went to health for a little bit, back to children's social care. We've had a focus on poverty, then a focus on health, and a focus on education, and then social care, and the different age ranges. So we've learned from all of this, and that shouldn't be lost. We've learned from all of it, but we also know that this hopping around local authority departments and different agencies doesn't necessarily help or lead to family integrated services. So again, we welcome this family hub focus on co-location, of trying to get us all together. We've got presently, we've got midwives, primary mental health workers, health visitors, and EOTAS, either in or moving in to some of our larger buildings. But this doesn't necessarily lead to co-production and co-delivery. Next slide, please. So this when I say this co-production, co-delivery, you know, and how we move to sort of real true integration is the challenge for us in family hubs, and it's the right challenge at the right time for us with all that learning that we've had. It's a whole system change, and the system needs to be brave enough to embrace the change. Let's get over our professional heritages. Let's start talking to each other and working together. This is the exciting part for me. Throughout my, I guess, my career, I've always been trying to push that consistent, sustained messaging. So basically, if I go into the family hub and I see my midwife in there, and I see my health visitor there, and I see my early years practitioner there, and they're all saying the same thing. They're all saying the same thing around sleeping, around boundaries, around smoking, around breastfeeding. That's going to be telling me that this is important. This must be right. Next slide, please. So I just want to say a little bit about the development here of our Northumberland Early Help Prevention Intervention pathway. When we streamlined all of that delivery in Sure Start, and I'm sure again colleagues will know about this, we had about 48 different programmes running across our children's centres, called everything from like little tinklers to baby bumps. In 2018, we looked at all of these and we took the best of everything and created our prevention and intervention pathway. Our prevention programmes are these are the ones we took the best from everything from across the system, so including health. And we formed our prevention groups there: Brilliant Babies, Early Explorers, LTTP and Tiny Talkers. These ones we're working really hard on, and we've done this since 2018, and we're working with the Early Intervention Foundation to get some evidence base attached to these. You can read them later about what exactly they do, but they're obviously picking up the sort of attachment and bonding, then moving through to babies becoming more mobile and walking and what that means in terms of safety messages. Babies where there is not a diagnosis yet, it might not be a diagnosis, it might be something else, but that's the LTTP and Tiny Talkers, obviously, which is our speech and language programme. And then we've settled on 4 intervention programmes. These are evidence-based, so these are our evidence-based programmes. So like a lot of people, Henry, Incredible Years. And then more recently, we've moved away from the domestic abuse delivery, like freedom programmes. This isn't early help, this isn't prevention. And so obviously we've now focused that work and our delivery on the healthy relationship work and the parental conflict work. Next slide, please. So this slide here demonstrates how we've made this a clearer referral pathway to show the different thresholds in our early help work. So our early help family workers, and that's through the multi-agency referral form. Then obviously we have the sort of, again, the targeted intervention, the targeted prevention courses, almost like that universal plus. And this very much relies on our health partners, our health visitors and our midwives referring into these programmes. And then I'm pleased to see in family hubs, again, this focus on the universal offer. This is how we get our families in to progress up those different thresholds or down or where we need to.
Can I just give you a 1-minute warning, Jackie? Sorry.
Yeah, okay, no, that's fine. Okay, next slide. So again, there was another question that came in before into the network about the use of creative methods to our underserved groups. The underserved group for us, we focused here on the rural. When COVID hit, we had to quickly figure out how we were going to deliver our prevention and intervention pathway across our vast rural offer in COVID. And we switched to a virtual offer. Now, this was mainly reliant on early years practitioners. They were reluctant at first. They didn't want to be filmed. It was like, oh God, this is awful. And then some embraced it more than others and really went with it, as you can imagine, and involved puppets and all sorts. So this is what we did. We harnessed their skills in a different way with what they were comfortable what they were comfortable doing. There is a little clip at the bottom about a video, which is a film that an EYP made that lives on a farm. So you can be able to watch that at your leisure. Next slide, please. Following on from this, our virtual offer has become more sophisticated. We're now using our week in the life of different centres on Facebook. There we go. And so we've got much better as we've gone on with this in terms of how we do the virtual offer. We've actually ceased all of our websites. They're not the place people go anymore. We use Facebook in the main, and then our midwives are telling us that birthing parents of today are the TikTok generation. So here we go. We're going to have to learn how to do TikTok along with our midwifery colleagues as we go forward. Next slide, please. We monitor our sustained engagement of families in our 10 to 30% most deprived communities, and the delivery of our pathway virtually saw an increase in this, and particularly in our deeply rural areas. So you can see how that sustained engagement went up. So here we go. No need for pram pushing distance anymore. We can do this virtually. Other outcomes were the participation, particularly from fathers and from partners. So we delivered incredible years at 7 o'clock at night directly into homes. And what you would get is mum watching, and in the main dad looking over the shoulder and us saying, why don't you sit down and join in with this group? So yeah, lots of spin-offs. Next slide, please. So we were successful for this virtual work in getting a Northeast regional bid, and we partnered up with Redcar and Cleveland Borough Council, which was great. We've got a really good relationship there. We learned so much from each other. We learned from Redcar and Cleveland about how to deliver to older children and young people. They have youth centres already based with them, so there's continuing learning going on there. We shared our virtual delivery, and actually we got the practitioners talking to each other. So our early years practitioners talked to their practitioners about, actually, you know, it does seem really scary when you're being filmed, but you do get used to it. And that it's not that bad. So next slide, please. Again, with Redcar and Cleveland, we researched together the best virtual delivery methods and also the best equipment. What a minefield that was, but we all know now about what a fisheye lens does. And so there's some pictures there about how now we've got that virtual delivery, and we can also run hybrid models of people on the screen and people in front of us with practitioners and with families. So these are the pictures of the rooms. The early help family workers can use these to do TAFs. And get people together from very rural areas. This has been a real success, and social workers can use them for CP conferences. You'll see one room down at the bottom there. I know it's very small, where we've adapted one of the rooms as well. It has a clinical bed in there now for midwifery appointments. So we have clinical beds in family hubs and clinical spaces now. Next slide, please. So where are we now? So we are engrossed in the sign-up process and the Trailblazer. We're really pleased that we'll be able to get that in by the 29th of September and then take a bit of a breather. On Monday coming, we are doing a soft launch of our family hubs, and basically really of our new logo. During the summer, we've been consulting on a new logo. So plans in place Monday, great day of, right, this is us, we're family hubs, we're on the journey. In terms of services, we are looking at a service offer, but we're talking to lots of people basically around an approach, more of a family hub approach. So for instance, in terms of including the youth services, we're talking about that whole family approach to youth. The whole family needs to be involved in what this young person needs. And we're starting to change some of our buildings to be young people friendly. You know, we've been very sort of primary colours, obviously in children's centres, so we're having lots of conversation about that as well. In terms of family hub development, we are developing a project team with lots of sort of community engagement workers, again, evaluation people and workforce and culture people for our family hub rollout. But we're doing this jointly with public health. So we're looking jointly with public health on things like community connector posts, and working together. I think one of the most important things is, together with public health, we have engaged a university research partner, because what we really want to concentrate within our delivery is integration doesn't necessarily lead to co-production and co-delivery. So what is it about integration? What is it that we need to be looking? What's the best messages we've got out there for us to be able to do that? And I think involving the university in that is going to really help us. So there you go. Thanks very much. I know that was a bit of a race through, but hopefully managed to do it within the time scale.
Thank you so much, Jackie. And I just want to absolutely put a massive thank you out there to Catherine to start off with, but then to take us on to the development and the implementation. What a great understanding, and all the support that Bronya is giving across the region in relation to the support from Anna Freud. But then just to hear Stockton's journey from Kelly, and then Jackie, some massively creative stuff that you're doing in relation to virtual. I think the richness of the input is just stunning. So thank you very much for that. But I have noticed in the chat that we have had lots of questions. We've also had lots of questions already answered in the chat. So that's marvellous. Thank you very much for that. I can see also a lot of connections being made. So that's brilliant. We are going to take just 5 minutes for a comfort break. It's not a comfort break as in let's go off and spend quite a lot of time away from the screen. If you don't need to go, don't go, but we will be coming back, and we will be starting in 5 minutes with some Q&A session. So thank you very much, everyone. Stretch your legs for a couple of minutes, and see you back here in 5, which will take us to 11:15. So we are just a bit over, Heather, so but I think we'll be okay. Thank you very much, everyone. Okay, everyone, welcome back. We now have the opportunity to move on to a Q&A session. And I just want to say thank you again for, I am absolutely inspired by the input that we have had this morning. It is so exciting. But we've got the opportunity to have a discussion with our speakers, and we also have some other panel members with us, David Gardner, Leslie Sanchuk and Lynn Howie, that you can see from the slide that's up. So we may come to them as well to hear some of their reflections from what they've heard this morning. But we have collected a number of questions previous to this session, but also there are a number of questions going into the chat. It is designed, we've got just over 30 minutes, so it is sort of designed to be interactive. It is a huddle, you know, we are wanting to feel that we can ask whatever questions that we've got. I can see that quite a lot of them have started to be answered in the chat. And there's also quite a lot of connections being made, which I think, given the whole notion of networks, I think is fantastic. So that's really, really good. So I've been trying to keep a bit of an eye on some of the themes that have been coming up. And if anybody wants to ask a question direct to the panel, do feel free to raise your hand and I can also come to you. But one of the themes that I've been noticing from some of the questions is the links with mental health services, but also in relation to improving outcomes relating to maternal and infant mental health. And I wondered if that was a question that we could potentially start with. And come to our speakers to respond to. How do you see the links with mental health services, and also what are your views around improving outcomes relating to maternal and infant mental health? So I don't know whether Catherine or Bronya would like to pick that up, or Kelly or Jackie.
I'm happy to speak to that, Catherine.
Okay, Bronya, and then I saw Catherine take her mic off, so we'll come to you after. Okay, thanks. Bronya first.
So I've got a bit of a passion about parent and infant mental health, and I think family hubs are an opportunity to focus on parent and infant mental health from a prevention perspective, from a sort of whole system and whole family approach, understanding that link, you know, across generations, and also the fact that, you know, we don't have mental health on one side and physical health on the other, that they are interlinked as well. And I think that's why we need a bit of a sort of system approach. And I think we recognise the importance of the critical first 1001 days a lot more now. And obviously with family hubs and Start for Life coming together, this is an opportunity to sort of prioritise parent and infant mental health in this period. And I think that, yeah, there is going to be £100 million worth of funding for parent-infant relationships and parent and infant mental health, and I think this is a fantastic opportunity. And I think obviously I would just, you know, encourage areas to think about what the evidence base is in relation to this, think about what families want and need in relation to this, and also sort of what best practices. I know there's the BABS service, trying to remember where that is. It's in the northwest somewhere. I think it's in Sefton. So if anyone wants to look at the BABS service, they've got an interesting service in this area. So it might be worth looking that up. I can pop the link to the chat if anyone would be interested in that.
That's brilliant. Thank you very much, Bronya. I don't know, Jane, are you going to come in on that BABS service? Because if you are, that would be great timing. If not, then we'll leave you to after we've heard from Catherine.
Fine to wait after Catherine. I was going to talk about mental health, but not that specific service.
Okay, that's great. All right, thank you. All right, Catherine, would you like to respond to the
thank you.
theme?
I just wanted to add really that the way the Department for Education has implemented family hubs, as you know, there's been sort of funding and investment in several areas, but the biggest chunk of money so far has gone for these 75 local authorities which are eligible for Start for Life family hubs. And I think this is a great time to be championing, perinatal infant mental health all these this area of services is really being championed here. And I think in some ways what we need to watch out for is what happens when we move on to the next pot of funding and to different things being prioritised. Andrea Leadsom, as you're probably aware, has worked really hard with that 1001 critical days to champion this level of care. And I think it's brilliant that so many local authorities are going to be able to access that. But we have to think about those that can't access it, who aren't eligible, and how we ensure that they are encouraged and helped to develop this area of this work. So I think it's just good to sort of call that out and raise awareness of that issue.
Yeah, thanks very much, Catherine. And I guess the system leadership is going to be key, isn't it? And also that first 1001 days. Which I'm a big advocate and champion for. So thank you for that. I think, Jane, you wanted to come in and then we'll go to Jackie.
Yeah, thanks for that. Yes, very briefly, just wanted to say that at Northumberland Place, we are going to be involved in the working through of the hubs and their development. And for me, I'm one of the mental health commissioners over at Northumberland Place. And I think it's going to be a really important and an excellent time to be able to incorporate, all of that preventative work and think about that parental, sort of perinatal and infant health. But I think we need to remember, of course, that children's mental health is often reliant on and impacted on their parents' mental health. And I think that the opportunities that we've got through this work, linking through our mental health transformation work, is a really great opportunity to be able to pull these kind of strands together and to further increase that opportunity to really integrate our workforce together, so that we reduce those boundaries even further and those barriers, so that we can increase links. And I think the other thing for Northumberland that's really important is the development of our recovery college, and I've no doubt that our recovery college can play a really creative role as well in terms of engaging with people and those smaller communities as well. So so it's a really exciting time for us in Northumberland. Thanks.
Thank you very much, Jane. And I think that notion of integrating the workforce, I think you got a bit of a clap when you mentioned that. So yeah, I think that's really important. Thank you very much. Shall we move to Jackie? Do you want to come in on that?
Yeah, I think there's a couple of things for me, and it's what's exciting is having conversations with my midwifery lead around perinatal mental health and how that links. It's got to link to the inequalities and the poverty agenda. We are going out, our early help family workers are going out, and people are going, I don't even know I'm going to afford a Moses basket. So how does that low, moderate, how does that escalate? And that we need to be in there the earliest possible point that we can be, to say, right, okay, let's have a talk about this. Let's get your Moses basket. Let's get that sorted. And that's great, because the other thing is that we've started to work with mental health concern and the link workers and the recovery college. So we're starting to have those very early conversations about. There has been questions in the chat, hasn't there, about how we're going to link in and how we're going to commission the voluntary sector. And that's very much where the voluntary sector comes into its own, with those community connectors, those peer supporters. And I guess for me, the social prescribers. So we're looking across that whole system to see who's the most trusted person for that family, who's the best at this. Let's harness all of that knowledge. It doesn't have to be us. I think for me, as an ask to this as a health network, would be to try to understand the referral pathways, because I'm still struggling to figure out the referral pathways. As I understand it, it's GPs that diagnose low to moderate mental health. But that would be, if there is something out there, if there's something that gives me and my communities a really good example of the referral pathways to these services, that would be most helpful. If there isn't, then that's what we need to work jointly on.
Okay, thanks very much, Jackie. Some joint work there. I noticed that Jan, your hand went up. Did you want to come in on this theme?
Yeah, so I'm Jen Rigby and I work in the Specialist Perinatal Mental Health Service, but I'm also clinical lead for perinatal mental health. So I know I've been chatting to people in the chat. I've been around long enough to remember how absolutely influential the Sure Starts were, and how what a void they left behind. And I'm just really excited to see that we are in a position to have the family hubs open and set up. I'd be really keen from a specialist point of view for us to have really good links with the hubs, and for us to maybe do some work in the hub, so that we're looking to promote those families that may struggle to go through the doors to help get there. We've also got peer supporters in our service, so again it would just be about how can we work together to get those really vulnerable families working with yourselves. I think there's enough work for all of us. We know that in the North East. We don't need to be precious about any of this, and I suppose many of the questions I was posed is around how do we make sure that the staff can hear what they need to hear in the family hubs, so that women can talk about what is often a very vulnerable feeling, to say I'm really not very sure what I'm doing, or I don't feel very confident in this role. So yes, I mean, you know, a big hands up from us, and I'm really excited to see where the next 2 years takes us.
Okay,
And thank you for today, it's been great.
Thank you very much, Jan, that's great. And we've got also Lynn from our panel who would like to come in on this. Thank you, Lynn.
Yeah, thank you. Just echoing what other people are saying, this sounds really fantastic. And I suppose thinking about things from the mental health perspectives, what we know is that although there's some, you know, a minor genetic influence on developing mental health difficulties, actually most are develop in response to experiences and the environment. And actually, by becoming a core partner within these hubs, I think that what we can do is to really avert some of the mental health difficulties that might come about because of people's experiences and the environment that they're in. And I think it's an absolutely crucial aspect for your mental health experts to be absolutely in the door, and to be with and be working with people in the family hubs. These are just absolutely fantastic opportunities to make a huge difference in people's lives. I'll just throw another statistic at you. First mental health presentations, 75% of people that will develop a mental health difficulty will have done so by the age of 18. So it's absolutely crucial for the well-being of everybody that we get things right at this age.
Absolutely, and all of that theme of early intervention and wrapping around it. And I've heard that statistic before, Lynn. Yeah, that's a worrying one, isn't it? Okay, thank you very much for coming in on that. Kelly, would you like to?
Yeah, I think probably a lot of it has been covered, but I think an important point to raise is recognising that we are not the specialist in all of these areas, and actually we need the support of our partners who are the experts in their own right to come and co-deliver or facilitate sessions from the family hub. So in Stockton, we are quite fortunate that we have two. We have the specialist perinatal service that come in and co-deliver with our family hub staff, and in turn those mums feel confident then and build those relationships up with the family hub staff, and then we start to see them creeping in without that specialist worker, which is fantastic. And that's what we want to do, is to build up that network of support. But we also have in Stockton Family Action, who deliver perinatal services for those families who don't meet that threshold criteria for specialist intervention. So they deal, they have a broad range of families that they're working with. They do TheraPlay. Again, that's co-delivered within our family hub settings. So it's trying to reach all of those families from those on that scale to those who are much more complex as well. But I think a lot of the mainstream programs, such as the yogas, the massage, you know, all of our Sure Start offer is still there and still encourages some of those mums to come in and continue to build those networks as well.
Yeah, absolutely right. Thank you so much, Kelly. And just having that conversation, actually, that's the whole purpose of this huddle. So much sharing and so much opportunity to learn from what's happening around the patch. So that's great. Thank you very much. I'm going to shift us onto a different theme. And there was a number of things in the chat around the role of charities and other community groups, and making sure that family hubs are inclusive of all services. And Kiz Crosby, are you in the room? Because you put a question in the chat around charities generally being on the edge, and how can we have more? Are you in the room? Stick your hand up if you are. And I wondered if you wanted to.
I am in the room, yes.
Great. Would you like to verbalise your question then, and we'll take a theme around that.
Yeah, of course. So I run a charity based in Northumberland, and we've essentially written into our charitable objectives is outcomes around mental health and wellbeing for children and young people. And we've had some relationships with other VCS organisations, and some sort of dabbling on the edge of kind of health authorities. We've had some funding via public health in Northumberland for the creation of some programmes, for example. But I think our general experience has just been that we've sort of felt on the outside, and it's very difficult to navigate the health system. And where networks like this are really, really important and helpful, and meetings like this are obviously brilliant, I'm wondering actually what we can do better as a collective to sort of formulate those links and partly understand better. So from my perspective, understand better sort of how the system works and how best to navigate it, so that we can focus our energies on almost knocking on the right people's doors, I suppose, but also to then showcase what we offer and what other organisations in the VCS offer, so that we can then look for those opportunities, because it all seems to be a little bit sort of haphazard and based on kind of who you happen to meet, or who you happen to have a relationship with, and that sort of stuff. So what can we do that is a little bit more strategic to help cultivate those connections, and then build meaningful partnerships where ultimately we can all bring different skills to the table to improve outcomes for children, young people and families?
Okay, great. Thanks, Kiz. So that's moving from the haphazard to the strategic. I wondered if there was any of our presenters or our panel members that would like to sort of come in on that theme. Catherine?
Yeah, very short response, which is I think this is such an important area, and I don't have all the answers. I think it's the next big thing that we really need to get right if we want family hubs to work. I think I've spoken to local authorities that have done some really good stuff in developing more equal partnerships with the voluntary sector. But I'm still really eager to hear from voluntary sector and local authorities that where they think they have got it right, because I think this is a very real problem, and I think we need to work really hard to improve things. I'm afraid that's not very helpful, but I wanted to say it.
That is helpful, because you probably articulated where a lot of people are at in the room, and I think it is important. So let's tease some of it out. Bronya, would you like to come in?
Yes, just to say the same sort of thing that I'm hearing from other sort of voluntary and community sector organisations, that, you know, this is an issue for them, and that, you know, the idea is that we'll hopefully be sort of providing some guidance on this. But it does take effort, it does take resources from everybody involved. It does involve being strategic and not just, you know, involving sort of whoever you happen to bump into at sort of events like this, for example. You know, I think this is a great sort of opportunity to connect people, but I think it has to be about more than that. And I think we need to really think about how to get all of the right people in the right room to make sure that we're getting things right for families.
Yeah, absolutely, Bronya. Thank you. Lynn, would you like to come in next?
Thank you. Yeah, just very briefly, I think what I've learned about working with the voluntary sector is that it can feel haphazard and chaotic, but actually what the voluntary sector bring to the table is a real agility. They can work in different ways alongside the huge organisations, with the organisational cultures and the constraints that come with those, but also the resources that come with those large organisations like, you know, the local authority and the NHS trusts. But what the voluntary sector brings is the agility to do something very quickly and outside of those boundaries. And I think that's what I'd advise the voluntary sector with, is instead of thinking that this is haphazard and chaotic, if you relabel yourself as being agile and being able to help out with things that these organisations can't do.
Brilliant, thank you. So that, Lynn, is a great reframing. A great reframing, thank you. David, would you like to come in on this?
Yeah, thank you very much for just an incredibly important point to raise, and a really welcome discussion. And I think there's something within all of this about recognizing that we're using the same language sometimes a little bit interchangeably. So we've got a new national program supported with additional investment, which is, you know, described as family hubs. We've also got existing local practice that has been emerging over a number of years, which has been described as family hubs, and the two are coming together, and we're trying to share learning and best practice across all of it. And one of the things that stood out for me was recognition of local place and the importance of local place and local partnerships throughout all of this development. So there's, and the place for VCS organisations within that is really clear and well established and of vital importance. So there is, I guess what I'm trying to articulate is there is no barrier here to us building far better, more strategic links and supporting that. There are individuals who are named at a local authority level who are the leads for the new funded family hubs that are emerging. So I think there's something practical about making sure that we are sharing key contact details wherever possible. And I don't know about the role of organisations such as VON within all of this, voluntary organisations Northeast, as that umbrella organisation. Is there a conversation to be had there to support engagement of VCS at local place as well? But perhaps leave that to local partners to suggest. But I think it's of vital importance. So a really good question, and welcome the discussion on that.
Yeah, thank you very much, David. And I think you're posing some further important questions. And I think this is being identified as no easy answers, but one of our system leadership challenges we really do need to grapple with. Kelly, would you like to come in?
Yeah, I think there's a plethora, isn't there, of local voluntary community groups out there, and it's about whether they align with the Family Hub principles. But ultimately, I think my advice would be approach your family hubs direct and approach your service leads. Within Stockton, what we do have is we have Catalyst, who is an organisation that supports all of our VCS services in Stockton, and we attend their strategic operational groups, and that is a really good way for us as family hubs to make those connections and make those links with voluntary organisations. And we have identified a number of them to come in and do work with us within the family hub as and when the need arises, really. So that would be my advice.
Okay, thank you, Kelly. Jane, would you like to come in?
Yeah, thank you. Sorry, I had technical problems there with my microphone. Just following on from the points that Lynn made, really, she's absolutely right that the voluntary sector offers so much flexibility and creativity as well. With the voluntary sector, you know, there's always a way around something. And I love the way that they're not constrained, you know, by the kind of rules and regulations that maybe some of our statutory services have. And I just wanted to say, in Northumberland, we've developed a recovery college that isn't traditional. It's not a traditional recovery college. And we've been able to set it up through our community mental health transformation monies. But our recovery college is about the wider health and well-being of the whole population of Northumberland. It's not just about those people with a mental health illness. And so for us, our recovery college is a really good kind of broker on some occasions, but a really good kind of link with our voluntary sector. So they've undertaken and continue to undertake a lot of work in terms of mapping what we've got, but also really getting into those conversations and developing relationships with our grassroots organisations that wouldn't necessarily be known by somebody like me, a mental health commissioner. And that's really interesting and really important for Northumberland because of the geography of Northumberland. So some of those very small rural areas have some excellent community groups going on there. And it's about understanding that and linking all of that kind of work into this wider kind of family hub work. So I just think that it's just a note to Jackie to say that I suspect we're going to find a lot of really rich stuff that we're going to be able to tap into. So yeah, I just wanted to say that that's something that's you know, going to be a really good source of resource for us in Northumberland.
Okay, that's great. Thank you very much, Jane. And then I think we've got Leslie from the panel that would like to come in on this bit.
Hi, yeah, I just kind of wanted to reinforce what people have said, really. And for me, and in Cumbria, as we develop our family hub, I feel a bit like I got imposter syndrome today with hearing all of the fantastic stuff that's going on. The voluntary third section community organisations are at the heart of what we're trying to do. And I think when we think about that wider workforce transformation, I think we've got a real opportunity right across the workforce, including local authority, statutory, voluntary third sector, faith groups, all of those things that provide that kind of grassroots connections that we really, really need to use and build on. So for me, absolutely at the centre and heart of what we're trying to do.
That's great. Thank you very much, Leslie. I think that was everyone that wanted to speak on that aspect. I think we'll just take one more theme, if that's okay, and then we'll hear any other reflections from our panel. But Graham, I can see, Graham, you're in the room, and you did put, it's gone quite a way back now, but I did spot something that you put in the chat, and was a theme about interested in understanding more about what brings people into the hubs, and has anyone done any kind of engagement and insight work into that? I don't know whether you want to verbalise your question.
Thanks, Catherine. I thought you'd catch me in between the hop between rooms. That's why my camera's off. Really, the question was just around, I think there's a danger as well, isn't there, that you continue to engage with the families you've always engaged with. And what do we know from, has anyone done any work in terms of use local data and intelligence to understand some of the things that our families, and particularly I suppose some of our vulnerable families that don't always traditionally access services, what do they access outside of the family hubs? And I'm thinking along the lines of sort of, what are the new things we can anchor in family hubs that will bring new people in that we've never seen in there before? And I sort of wondered, has anyone done any work already or got any work in the pipeline to look particularly at some of the data in terms of some of the key services that sit outside of suppose a family hub setting, even in sort of clinical settings, what we can maybe look to be bringing in family hubs to anchor those services so that we get wider engagement from sort of families. I'm just thinking along the lines of sort of when you talk about you know, maternal mental health services there, for example, sometimes people won't engage with those, but if we have things in the hub that people come in to engage with, they might see the benefit of coming in and actually accessing those services as well. So it's really just an ask of anyone around the table if they did have anything that they've done or in the pipeline, really.
Okay, thanks for that, Graham. And I think Kelly's going to give us all those answers. Kelly.
I'll try. So I can't take any credit for this. So Anthony Borden, my newly appointed Community and Partnership Manager, has recently undertaken a survey within Stockton to reach out to those parents to say, why don't you access our family hub services? So we can get more of a broader understanding. That data is yet to be analysed, but I think we had about 600 people responded to those surveys. Additionally to that, we have created family hub forums that are represented by parents who don't routinely access our family hubs. So we've had to go out and reach to other services to say, do you have families who don't access our hubs, and can we have them? We want their voice, we want to be heard, we want to understand why they don't routinely access the provision that is available from family hubs. We do know, Graham, that ultimately those who come into a family hubs are those who are going to be there by choice anyway, or actually the forced, as they would put it, by social care, because a referral's been made, have to attend that parenting course. But we need a wider reach outreach to those families that wouldn't come over our doorstep. So we've recently had a restructure, and we've created roles of engagement workers that will now go out into our communities to those that won't come across our doorstep. They'll go out and do joint visits with our social workers. They'll go out and do those joint visits with health visitors. They'll go into schools and have much more further reach with those families, cast the net a lot wider, not waiting for families to come to us.
Yeah, so that whole reaching into the community. Yeah, thank you very much, Kelly. Catherine, should we pass to you? Thank you.
Thank you. I'm so glad that Kelly mentioned that, because I was thinking of that very survey. And I remember also that you talked about using social media to target and engage with different groups of people. And I think that's quite an exciting area. You can use very small amounts of money to target particular groups of the population. And it's great to hear about innovation in that area. The other thing I wanted to raise there was in terms of getting people in, one of the most pressing issues we find people coming into family hubs for is when they've got housing concerns. And as many of you are probably aware, quite often when people have housing problems, they find it very difficult to get support and advice. So family hubs that have offered a housing drop-in with, say, a housing officer or citizens advice, or other people who can offer advice and a listening ear to people who are struggling, it can be a great way to bring in families that you couldn't normally access.
That's great. Thank you, Catherine. Yeah, Graham, we're doing some insight work, aren't we, in Redcar and Cleveland in relation to the best start in life in the first 1,001 days. So it's just giving me a thought on how are we going to keep this conversation going at a regional level. And I know that there are some sort of groups and networks, but I think that's a question for us. But thank you, and thank you, Catherine. Is that okay, Graham?
Yeah, it's fab. Insightful, thanks. Yeah.
In the time that we've got left, I just wonder, we've just got 5 minutes. I wondered whether there were any sort of final reflections from our panel members, either David, Leslie or Lynn, whether you'd like to offer any final reflections, and if there is anything burning, because I have noticed that quite a lot of the questions that have been raised have kind of been answered. But if there is anything for anyone in the room that has anything desperately burning, then please do raise your hand and we'll use the last few minutes to come to you. David.
Thanks, Catherine. I've been frantically scribbling notes down for the last hour and a half or so, so I'll try and make a coherent point now. But I think the first point that I wanted to recognise was a real fantastic energy that there is in a room now, and how great it is to be building services and looking to establish something better. That feels really positive and nice to be part of. I recognise as well that the expertise is at local place. You know your communities, you know your people, you know your services, and continuing to build on that is incredibly important. So whilst we're establishing the network and we're sharing practice, that's really important. I think alongside those specific examples, it's about developing a really strong public health informed process behind the development of all of this. So it is about having a really sound needs assessment that should be clearly informing your local strategic approach. Governance and partnership governance at place is really important. And as you're developing your services and answering those really specific operational questions, it must be led by engagement with your communities and a real understanding of what their needs are versus that kind of professional perspective on what the needs assessment might indicate. And I think through that, a lot of the questions that are being asked are answered because your process is really strong, because you've committed to those principles around engagement, use of evidence, both local and national, to develop your solutions. And I was really encouraged looking through the guidance that is available to us in terms of the frameworks and things like that. There's no upper ceiling to this. Its control is given back to local place. There are some minimum standards, but be really ambitious. Be creative, look for the solutions, and there's nothing there that limits us in doing that. So it feels like a really positive thing to be part of. There's a huge evidence base that we're building on. It's great to have some additional investment, and if we're taking some steps towards offsetting some of the wider determinants and the poverty related issues that open today's session, then that's a vitally important piece of work. So just a huge thank you to everybody who's throwing their energy into this space, because it'll make a big difference if we work together. So thank you.
Thank you very much, David. Should we move to Leslie? Would you like to give us your reflections?
Yeah, agree with what David said, but I also think there's something about that commitment to understanding the impact of adult choices on the lived experience of children, and how we integrate the voice of children and young people into the way that we develop family hubs going forward. And we've done some work with our safeguarding voices in Cumbria, and the message from our young people is quite clear. They didn't want, you know, separate early help strategy or any of that. What they wanted was professionals to have a toolkit, and for that toolkit to be part of our family hub. The other key messages for us is they didn't really care what we were called. And I wonder if that helps with the kind of conversation around the voluntary third sector organisations, to get rid of some of that kind of language around what people might be called or what badge they might wear. So some really key messages for me around workforce transformation, working together closely, and really thinking about children and young people, not just little children, but all children. I think it's been really important for me as well. So thank you.
Thank you very much, Leslie. Yeah, that life course of the young child and the young person. Great, thank you. Okay. Any final reflections, Lynn, or any final reflections from Catherine or Bronya? And just make the no hands gone up, so there's nobody that's left with a completely burning unanswered question. Catherine?
I think my sort of closing observation is that this work is so wide-ranging that we all need to not wait for someone to come to us and say, would you like to be involved with the Family Hub work? We all need to be really proactive and making those links and reaching out. And I think if as many people on this call as possible could do that, then we're far more likely to achieve what's possible.
Yeah, absolutely. Thank you. And I'll just bring Bronya in for the before I round it up. Yeah. Okay,
Yeah,
Bronya.
just touching on what Catherine said, you know, do be proactive, do reach out, because there is a lot of support out there. So yes, please do come out and find us.
Okay, thanks very much. Well, I'll just spend a couple of minutes just bringing things together and also saying a few thank yous. This is my first huddle actually, and I just think it's been amazing. And David, you encapsulated some of my thoughts actually, which was around the amazing, fantastic energy that's in the room, and the amount of learning, the amount of sharing of ideas. I've just got a Microsoft update. Thank goodness it's going to do it in 29 minutes and not 2 minutes. Just the amazing sharing of ideas and the connections. So there are things that, you know, the 75 local authorities is one thing, but actually this is for everybody, regardless of whether you're in an area that is getting the additional funding. But some of the other key messages that were chiming with me was the fact that, David, you said this, was that the expertise is at a local place, and there is no blueprint for this. And so it does need to be informed by what's happening and what's needed at a local level, but actually really understanding what's needed at a local level. How do you get alongside the community to really find out that kind of understanding? And so that engagement with community. So I was really interested in what you were just talking about that Cumbria's been doing. So the opportunities are just absolutely limitless, aren't they? And as an ICS region, with the kind of network structure that we've got, we can carry on the conversation, and that'll be something, Heather, I'd be really keen to have a conversation about how we ensure that the wide-ranging conversation and everybody that's been involved in this conversation, because it isn't just a local authority development, how we can make sure that we capitalise on that for the benefit of improving outcomes for our children and families. But the other thing that I would really like to do with the 1 minute that I've got left is say a huge thank you to Catherine and to Bronya, but also to Kelly and to Jackie for sharing your experience. I think it's an amazingly, great thing for people to get into here and putting themselves forward and sharing your experience. And you said, you haven't got it cracked. You never get anything cracked where we're talking about system change and transformation. There is no one answer to anything. But there are limitless possibilities, and just hearing from you has been absolutely fantastic. So I, on behalf of everybody, want to just say a huge thank you, and thank you to everybody in the room for contributing, for all your questions, for all your engagement, but not just that, but actually all of the work that you're doing together. It is absolutely fantastic, and the kind of positive difference that we can bring about for our communities and our children and families is absolutely amazing. So it has been an inspiring morning. Thank you for putting that word up, inspiring, and thank you very much for inviting me to chair it. And at that point, I think I can hand my chairing responsibility back over to Heather, who is just going to round off our huddle. But thank you very much. It's been an absolute pleasure to be engaged with it. Over to you, Heather.
Thank you, Catherine, because there's a final and very important thank you before Jen signs off, and there's some important key messages, so I will ask that colleagues don't sign off just yet. But your expertise, I saw a master at work today, Catherine. I know it's the first one that you've done today, but it was amazing to watch you at work, and you put what was a very complex agenda. We normally have one speaker, and you had a panel and 4 speakers to contend with, and you did that fabulously. And I think because of that, it enabled not only the speakers but everyone attending to get more out of it. So thank you very much for that. And unsung heroes, in particular Jen and Amelia, who do a lot of the work in the background. Huge shout out to them. And Jen is getting someone to sort out her Wi-Fi this afternoon. There's not normally a lag on it, but there appeared to be today. So thank you very much to that. And I will now hand over to Jen, because the networks enabled this, and I'm really keen to have those discussions with Catherine, and we're true to our vision that we're bringing people together in partnership to enable young people to thrive. So if you could just stay with us, and so Jen can share some important messages before you go. Thanks, Jen.
Thank you. I can move my own slides on now, see if it works. I'm just going to keep you just another 2 minutes just to make sure that you're aware of some of the messages and some of the important links and useful information when you get the slide pack through, because you'll be sent all these slides through, and there's some links for you to read some more information about the network and some related information, such as this report, which was released a couple of weeks ago from the Institute of Health Equity, about fuel poverty and living in cold homes and the effects on young people and families in particular. So the network is building a proposal around a call to action based on this evidence base, and obviously the new report from the Child Poverty Commission from today will also impact a lot of our plans around this. So the network has quite a clear focus on health inequalities affecting children and young people, and it's just the cost of living crisis. I mean, we don't need to go back over it, but obviously it's a huge impact across all of our work. So it's something that we recognise that we need to do something about where we can, and it will cross-cut a lot of what we've been talking about today. If you're interested in our kind of work so far around child health inequalities, we had an online event back in May, which was really well attended, that shared a lot of best practice examples from across the system from different organisations working in different spheres of child health inequalities. And we produced a showcase brochure from it, which has lots of examples in, and the contact details for all of the project leads. So some of it may be of interest to some of your work. If you want to follow this link when you get the slides, you'll be able to have a look at it online, and if there's anything that takes your interest from there or is relevant to you, you can contact the project leads directly. I just wanted to bring your attention to the Healthier Together website and app, which is a signposting website with loads of information, specifically aimed at parents and carers of young children especially, but they are increasing the content for older children, and a specific section for young people in particular as well. And there's a lot of professional resources on there again, which is expanding all the time. So I would encourage you to please, when you get this, there's links here that you can download the app yourself. You can recommend it to the families that you might work with to signpost them to it. And there's QR codes on there as well, which will send you to the link to download it. And just finally, just this little table, there's little links on here of different ways that you can engage with the network. If you aren't already a member and you've just come to this webinar, you can join the network and make sure that you get all of our communications, all of our newsletters and that sort of thing. Engage with us in a few different ways. This rolling huddle of programs on different topics every couple of months. So please join us if you haven't already, and you won't miss out on anything. And just a final thank you, and you can go for some lunch. Thank you everybody for coming today. Please pass your thanks. Please pass your everything you've learned today onto your colleagues, and please encourage them to register. Sorry, it's been a very long morning. And thank you all so very much for coming. All of our speakers and Catherine, our chair, has been fantastic. Thank you so much, everyone, and we'll hope to see you again soon.
Can we pause the recording, please, Amelia?